Identify the tag structure. Gabby here from bootcamp.com, and here we're looking at a dissection along the posterior abdominal wall. So this is an anterior view of the posterior abdominal wall. So we can see a couple of muscles here. So laterally, so this is going to be lateral. So laterally, we're able to see the iliacus muscle. And as we move more medially, we're going to be able to also find the psoas major muscle. So this area is going to be medial. Now, the iliacus and the psoas major muscles, their tendons eventually converge together, and we can call it the iliopsoas muscle. But that being said, the iliacus, the psoas major, and the quadratus lumborum muscles are three muscles that will go ahead to form portions of the posterior abdominal wall. Now, emerging in close proximity to these muscles or lying over top of these muscles are some nerves that are emerging from the lumbar plexus off of the spinal cord. So the lumbar plexus is being formed by a ton of connections between the lumbar spinal nerves. And eventually they will give off these branches that will go and provide either motor innervation or sensory innervation to the areas of the pelvis and even the lower limb. So let's identify some of these nerves that are found in these areas. So starting from superiorly, so right over here, we see one nerve. This one's specifically going to be the subcostal nerve. And the subcostal nerve is very similar to those intercostal nerves, but instead it's named subcostal because it actually travels underneath the very last rib or underneath rib number 12. And is specifically responsible for innervating some of the muscles and skin that are found in that region. Next, we have two nerves that are actually bundled together here. So those are going to be our ilioinguinal nerve as well as our iliohypogastric nerve. Now, the ilioinguinal nerve goes to provide sensory innervation to the aspects of the anteromedial thigh and is also going to give off some motor innervation to specific muscles, including the internal abdominal oblique as well as the transversus abdominis muscle. The iliohypogastric nerve will emerge here along the superior border of that psoas major muscle and will eventually travel obliquely and laterally, where it will actually go and innervate some of the muscles that are found on the anterior abdominal wall. It's also going to provide some sensory innervations to the suprapubic region, as well as the posterior and lateral gluteal region. Next here, we're going to have the lateral femoral cutaneous nerve, which as the name implies, is going to travel laterally into the femoral region or into the aspects of the thigh, where it will provide sensory innervation to the lateral aspects of the thigh. Now, before we get to our tag nerve here, we have a couple other nerves that I want to finish off with. Right over here, we're going to be able to see the femoral nerve, and the femoral nerve is going to originate off of L2 to L4 and will eventually descend and pass the inguinal ligament where it will enter into the femoral triangle to go and provide motor innervation to the muscles of the anterior thigh and also give some sensory branches to provide that area as well. And then over here, we have the obturator nerve. So the obturator nerve is also going to be emerging from L2 to L4. It's going to descend, but it will descend more medially, right? So the obturator nerve is the main nerve of the medial thigh. So it's going to be found more medial compared to that femoral nerve. So lastly, one of the other branches of lumbar plexus that we haven't mentioned yet, we see this nerve piercing psoas major directly and essentially traveling along the border of the psoas major, where it will eventually disappear and then branch into a genital branch and then a femoral branch. So this specific nerve is going to be the genitofemoral nerve. The femoral branch of the genitofemoral nerve will go and provide innervation to the areas immediately above the femoral triangle, so along the anterior aspect of the proximal thigh. The genital branch will go and travel to the genital region where it will go and innervate areas of the mons pubis, of the labia majora in females, as well as the lateral regions of the scrotum in males. The genital branch also provides motor innervation to the cremaster muscle, so it's super important for the cremaster reflex. So back to our question here, identify the tag structure. The tag structure is going to be the genitofemoral nerve.